All right, major depressive episode. Uh, Five or more of the following symptoms have been present during the same 2 weeks period and represent a change from previous functioning. At least one of the symptoms is either one, depressed mode, or two, loss of interest or pleasure. Note, do not include symptoms that are clearly irreversible to the medical condition. 1. Depressed mode most of the day, nearly every day, as indicated by either subject report feels sad, empty, or hopeless, or observation made by others, appears tearful. Note, in children and adolescents can be irascible mode, irritable mode. 2. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day, as indicated by other subjective account or observation. 3. Significant weight loss when not dieting or weight gain, a change of more than 5% of a body weight in amount, or decrease or increase in appetite nearly every day. Note, in children, consider failure to make expectation weight gain. 4. In anosmia or hypersomnia nearly every day. 5. Psychomotor aging or regime nearly every day, observed by other, not merely subjective feeling of restless or being so slowed down. 6. Fatigue or loss of energy nearly every day. Okay, just 7. Feeling of worthless or excessive or inappropriate guilt, which may be delusional nearly every day, not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concert or in the indecisiveness nearly every day, either by subjective account or as observed by others. 9. Recruit thought of death, not just fear of dying, recurrent suicidal ideation without of specific plan or specific suicide plan or suicide attempt. B. The symptoms cause clinical significant distress or impairment in social, occupational, or other impairments area of functioning. C. The episode is not irreversible to terrible to the psychological effect of substance or another medical condition. Note, criteria A to C consist a major depressed episode. All right, we have more. All right, note responses of two significant loss, bereavement, financial ruin, loss from natural disaster, or serious medical illness or disability may include the feelings of intense sadness, rumination about the loss, insomnia, poor appetite, and weight loss, noted in criterion A, which may resemble a depressive episode, although such a symptom may be understable or considered appropriate to the loss to the presence of the major depressive episode, in addition to normal response to significant loss should be carefully considered. This decision invaluable requires to exercise of clinic judgment based on the individual's history and the cultural norms for the expression of distress in the context of loss. Bipolar 2 disorder criteria have been met for the less one hypomanic episode, criteria A to F, under hypomanic episode above, and at last one major depressive episode, criteria A to C, under major depressive episode above. B, there has never been a manic episode. C, at least one of the hypomanic episode and last one more major depressive episode are not better explained by schizophrenic affective disorder and are not superimposed on schizophrenia from disorder, delusional disorder, or other specific or unspecified schizophrenia spectrum and other psychotic disorder. D, the symptoms of depression or the unpredictable caused by frequent alteration between period of depression and hypomania causes clinical significant distress or impairment in social, occupational, or other impairments area of functioning. Coding and recoding procedures. Bipolar 2 disorder has one diagnostic code F31.81. Its status with respect to the correct severity present of psychotic feature course and other specifiers cannot be coded but should be indicated in reading F31.81 bipolar 2 disorder correct episode depressed moderate severity with mixed features F31.81 bipolar 2 disorder most recent episode depressed in partial remission. Specify correct or most recent episode hypomanic depressed if correct episode is hypomanic or most recent episode if bipolar 2 disorder in a partial or full remission. All right.